What can you do to eliminate anxiety instantly without having to take any medication or go see a doctor? There is literally something that you can do right now. You don't need any special tools, no equipment. All you need is your body, and you can do it right now. I'm Dr. Amy with Physical Therapy for Everybody, and here we are focused on helping people create an active, healthy, and confident lifestyle, free from pain medication, and really any medication preferably, and from any surgery. In these days, a lot of people are really struggling with being able to control their stress and their anxiety. It feels like we are constantly being bombarded by everything, right? The news, social media, your friends, people driving down the road. It just seems like, have you been to Costco recently? I mean, guys, that's anxiety producing for me. So, what can we do right now without any special tools or any drugs or anything like that to help decrease our anxiety? It's what I do every time before I walk into Costco, and I make sure I keep doing it the entire time that I'm in Costco. I'm not picking on Costco, okay? I'm picking on all the people who are shopping at Costco. That's the truth, all right? But what I do is deep breathing. And the reason why is because not only does it activate my diaphragm, which is that big muscle of respiration that's really supposed to be able to help us breathe correctly, it also decreases the tone and stress in my neck and shoulders so I don't have my shoulders up as earrings. But the other thing is that it activates the vagus nerve. Now, a couple of years you may have heard about how the vagus nerve was all the rage, and there was these programs activating your vagus nerve and stuff like that. There was some confusion around that because some people felt like, well, the vagus nerve innervates the diaphragm, or it supplies the nerve innervation for the diaphragm. That's not actually true. What it is that the vagus nerve travels through the diaphragm. So when you do that deep breathing, the diaphragm almost kind of massages the vagus nerve, if you will. And that is really important because it helps to decrease your cortisol, which is your stress hormones. It also helps to decrease anxiety, and it also helps to decrease inflammation, which is a huge challenge because if you're in pain, right, you're like, everything just like tightens up, right? Because you have pain and you don't want to move correctly. And then when you're not moving correctly, your body can't heal itself. So a really simple step that we often start with here at Physical Therapy for Everybody is just getting people to be able to breathe correctly. Now, there's other videos on this site discussing how to breathe when you're lying on your back or lying supine, which is usually where I recommend people start because it's easier to do in that position, and also you can see that belly rising and falling. But today what we're going to talk about is how to transition that to a sitting position. So as I've talked about in my other videos, and you may have heard before, it's the deep breathing is really what we want to be doing all the time. So that's really the goal with all of this, is to be able to do that deep breathing literally 24/7. That's actually the goal. But we have to practice because in today's day and world, we don't tend to actually do that deep breathing very often. So we have to make a deliberate effort to practice. And I like to do that when you're lying on your back because it's a little bit easier in that position. But once you feel like you have pretty good control and you feel like, okay, I get what's supposed to be happening in my body here, then I recommend you try it in sitting. And when you're doing it in sitting, I want you to do the same technique that we used in supine or lying on your back. Sorry about that. So what you're gonna do is you're gonna start with both hands on your belly. You're gonna take a deep breath in slowly through your nose and try to expand your belly and make a balloon with your belly as big as you can. And then you're gonna blow out through your lips as if you're blowing on a soap wand. What is that? A bubble wand. There we go. As if you're blowing on a bubble wand, to gently blow the bubbles out until that belly bubble goes away. So you're gonna breathe in through your nose, make that belly bigger and really expand, and out through your mouth, getting that belly bubble to decrease in size. And I like to add a little bit of an abdominal contraction right at the end to make sure you get all of that air out, to make sure that you're really getting that full belly breath in and belly breath out. Now, once you've gotten that in sitting, what I want you to do is I want you to put one hand on your belly and one hand on your chest, because we want to make sure we're not getting too much motion through the chest. Now, most people tend to breathe up in here, right? That's not good. That's the fight or flight response, right? That's activating our body to stimulate cortisol because we have to run away from the bear. This is not what we're going for here. We're going for activation of the vagus nerve to get everything to chill. It is the chill response, and that's what we're going for, okay? So, but these ribs do actually move a little bit when you're getting those last phases of that breathing, okay? So you're gonna have one hand on your belly, one hand on your chest. You're gonna take a deep breath in as far as you can, fill up that balloon that's in your belly, and then that last sip of air will allow this area to move, and then slowly blow out through your lips as if you're blowing through a bubble wand. And then, like I said, I like to do a little bit of abdominal contraction at the end. So you're gonna breathe in and out. Now, when you're starting to practice that in sitting, you may find that it is more difficult than lying on your back, and that's totally normal. It's as we make these transitions to different positions, it's a little bit more challenging, but we tend to be in sitting more often throughout the day, so it's a little bit easier to be able to practice regularly throughout the day. So if you're sitting at a stoplight, you could do this. If you're sitting at your desk on a really boring Zoom call, you don't really need to pay attention. You can just kind of work on your breathing for a minute, and you look pretty normal, so like nobody will notice on the Zoom. It'll be fine. But integrating it into sitting at this point will allow you to do it more regularly throughout the day. Now, as I always say, I want you to be very gentle with your body, and when you realize that you have stopped that deep breathing pattern, I want you to gently remind your body, hey, we want to do that deep breathing. It's going to make things feel better. And, but a gentle reminder, okay? If we get mad at ourselves, oh, I'm not deep breathing again, what does that do? That activates the fight or flight response, right? That's not what we're going for here, friends, okay? We need to get things to calm down and relax a little bit. So be gentle with your bodies, give yourself a break. You've been doing this breathing pattern for how many years? And you're only just now finding out that you're trying to change it. It's a challenge. It's a new habit. It takes a while to make, okay? So I want you guys to be gentle with yourselves. Now, what if you really feel like you can't get that deep breath? I have had some clients come in and say, I literally cannot activate that. Now, I will tell you that some people have some adhesions in their diaphragm or even in their internal organs. We can get into that in another video, but some people are not physically capable of actually taking that deep breath. If that's you, at this point, you need to see a specialist physical therapist because they need to use some hands-on techniques to help that diaphragm move better so that you can actually get that deep breath. Because it is true, some people cannot access it because the diaphragm gets so tight that it's just holding on for dear life, and you're trying to take a deep breath and it's like, I mean, it's just like any muscle, right? If your biceps get tight and you're trying to like stretch it out and it's like, right? Sometimes that happens. So again, we need some gentle techniques to help get that diaphragm to be able to move correctly. If you have any questions about this video, please drop them in the comments below. If you like this video and like to hear more, we have more coming out soon, so click the subscribe button so you're notified when they come out. Have a great day, everyone.